As the Delta variant has hit our community, we have seen tremendously higher rates of infection. So in my own clinic, we're ordering a lot more COVID tests. We're seeing a lot more that are positive. And we've seen a number of kids that were having some of those respiratory distress symptoms that were concerning. I haven't personally hospitalized anyone, but I know that our hospitalists have been admitting somewhere around 5 kids a week with symptoms that are significant enough they needed to be in the hospital. I'm really concerned about COVID in kids. And while most kids who contract COVID don't get super sick, and they do seem to recover pretty well, there is a subset of kids that are getting pretty sick. And with Delta variant being so much more contagious, we're seeing infections in children rise just tremendously, just in our area, but also across the country. So the American Academy of Pediatrics was talking about this recently, about how dramatically those infections have increased in kids. We're also seeing kids get sicker than they were last fall. So this Delta variant seems to be a little bit more aggressive with children than the previous variant was. So we are seeing some kids getting hospitalized with things like difficulty breathing. There have been a few kids with COVID pneumonia. And then there's a small percentage of kids that go on to develop something called multi-system inflammatory syndrome. And that's quite a severe illness that usually requires kids to be in an ICU type setting. And while still most of them recover, there are a few kids who have died that way. And I think around 340 kids in the United States have died from COVID since the pandemic began. And overall, that's a very small number, and so that's still a very small risk, but that's 340 kids, that's a lot of kids. Myocarditis in COVID is fairly common amongst adolescents. So the most recent numbers I've seen is around 1 in 43 adolescents might develop myocarditis after COVID. And that can be pretty serious, involving hospitalization and months of recovery. Again, most of these kids do recover, but it's months away from sports and activities and just not feeling good. And so it's a serious thing. Adolescents who contract COVID disease, about 1 in 43, might go on to develop myocarditis. There is an association with myocarditis after COVID-19 vaccination, and that's most common in adolescent males. The overall rate appears to be around 40 per million, so it's a much smaller risk. The other thing about myocarditis after vaccination is it's a very different kind of myocarditis. And so after vaccination, we're seeing kids have symptoms for a few days before making a full recovery, whereas COVID disease-related myocarditis is much more serious. Children affected by COVID can have similar symptoms to adults, where they might have things like fever and body aches and cough, trouble breathing. We also sometimes see kids with GI symptoms, so like vomiting and diarrhea. I've seen pretty high fevers in kids with COVID. The reasons that kids get hospitalized are things like respiratory distress and not being able to breathe well, COVID-related pneumonia, and then that multi-system inflammatory disorder. I would absolutely recommend that anyone eligible for COVID vaccination get it, including kids 12 and up. And I'm anxious to immunize my own children. So my kids, my oldest is 11, and I have kids as young as 5. And I wish I could get my kids a vaccine. And most of my colleagues feel the same way, that we wish our kids who are too young for vaccination could get one. And those of us who have kids who are old enough to be vaccinated have had our kids vaccinated. So yes, I absolutely believe that vaccination is the right choice for kids. The vaccine works extremely well in children. They make a really nice immune response to the vaccine, and it's really well tolerated. So it's fairly common to have things like pain at the injection site, or a little swelling, some redness. After the second dose in particular, we commonly see things like fever and fatigue and muscle aches and just not feeling good. But for most people, that lasts around 24 to 48 hours. And so it's very short-lived, and then you're kind of back to your normal. And that's a normal response to have to a vaccine. We want you to create an immune response, and so you're going to see those kinds of those effects. In terms of serious adverse effects to the vaccine, there's a serious allergic response that occurs in a very small number of people. I believe that's on the order of about 4 per million for the Pfizer vaccine. And then this risk of myocarditis that we've talked about that occurs in about 40 per million overall, but is highest risk amongst adolescent males.
Still very low.
Yes, very low. And you're much more likely to get myocarditis from COVID than you are from a vaccine. So in choosing not to immunize, you're not choosing not to get myocarditis. You're actually putting yourself at a higher risk of myocarditis than you would be if you had the vaccine. I don't really have any long-term concerns about immunization with COVID. So historically, when we've developed and tested vaccines in the past, serious adverse events related to vaccines have all been detected within about 8 weeks of administration. So we're actually well past that in our study population, but we don't see long-term effects from this. The other thing is that these vaccine ingredients, which are actually very clean, there's very few ingredients in the vaccine, they degrade really rapidly. So that messenger RNA that we give with Pfizer vaccine to create that immune response, it's gone from your body within about 72 hours. So it's very unstable, it degrades really fast. And then the other components, which are mainly lipids and salts and some sugar, those are absorbed by your body really quickly, and those are kind of meant to look just like natural parts of your body. And so there's nothing really remaining that would cause a long-term problem. I'm not concerned about COVID vaccine affecting fertility. So I think some people had theorized that the spike protein on the COVID virus that we're trying to get our immune systems to recognize with the vaccine looks something like a placental protein. The two are chemically very different, and so the mechanism itself doesn't really make a whole lot of sense. The structure of those two things are very different, even if they might have similar names. The other thing is that in studies where we've given people COVID vaccine versus studies where we've given people a placebo, the same number in both groups have gone on to become pregnant. And so there's not really any evidence that people who have been vaccinated have had any infertility issue. And we're talking about millions and millions of doses being given worldwide. So it's something, in theory, we should have picked up by now. We're also seeing people who have had vaccine go on to carry healthy pregnancies and have healthy babies. There's really no evidence that it's going to impact fertility in the long term. And I'll also say that we don't know what the impacts of COVID disease are on someone's long-term fertility. And there's some thought that there may be some impact on that, especially for men. So I think, looking at my own children, I would much rather my children get the vaccine than the disease. I think that it's really important that the population, everybody who can get vaccinated, does get vaccinated, because that really helps protect not just the individual who receives the vaccine, but the people around them. And so the best way to protect the children in our community who are too young to get a vaccine is for those of us who can get one to receive it. That will help reduce transmission in our community and help protect those kids.